Good afternoon, everyone. Can you guys hear me and see my screen? You are not allowed to talk. You are all on mute. So please type your message in the chat box so that I can just know whether you can see my screen and are able to hear. These two are important things right now for us. Can you hear me, guys? Okay, great. And are you able to see my screen? Anyone can answer. Okay, that's great. Wonderful. So I see that there are 26 participants. I'm not even sure how many had signed up. I believe they were like a lot more than this. We'll wait for just about a minute so that nobody ends up missing out on anything. How's everyone doing? I hope everyone's enjoying the heat. Okay. I see that some more participants have joined. Anyway, I'll start. I think people will keep joining as and when they can. So welcome to the Medical Coding and Billing webinar. I am Dr. Ashwini Ghate, as you can see on the screen. I am a doctor as well as a certified medical coder. I graduated with a medical degree in 2000, and later we moved to the US, and that's where I got my certified professional coder certification. I decided to do something in something in healthcare field, but not exactly the hands-on clinical work that we do as doctors in India. So I decided to choose medical coding. That actually helped me stay in the medical code, healthcare field, because you can actually utilize your expertise, your knowledge in many ways, even though you are not exactly working on the patients. So I decided to do that, and I got certified in 2012, and later I worked in a company named Outcomes Healthcare Information Solutions till 2015. In 2015, I came back to India, and I have been training candidates since then. I must have trained over 150 candidates. Please put yourself on mute. Let me see if I can do that, because it's very distracting to others. Okay, I don't see. Oh, sorry. So yeah, a little bit about myself. I'm still talking about myself. So yeah, I mean, I have trained like over 150 candidates so far. Mostly my training is to become certified, the CPC training. And besides that, I have worked as a consultant. I'm still working as a consultant and freelancer with various US healthcare companies. I have been part of a startup, and I've also worked in companies that build medical coding software. So as a subject matter expert, so I have been in this field for quite some time, and I'm going to try to give you all an overview of medical coding field, why medical coding, what is medical coding, and career growth in this field, why choose medical coding. Some few aspects of it, from whatever I know, whatever I have learned so far, I just wanted to take this opportunity to share this with you guys. Now, let me move to my next slide. I see that the chat box, I'm keeping the chat box kind of handy because I would like to stay in communication with the participants since you guys cannot talk. You can, anytime you feel like asking a question or commenting, feel free to type a message. I have my chat box open so that, I can try and answer it right away, because if it gets piled up in the end, it's hard for me to actually just catch up with on all questions. I mean, yes, it is distracting, so I won't take each and every question, but if it is something relevant and quick, I may answer that, or we may take it at the end. Okay. So there is a saying, there is never a recession in the healthcare sector. That's absolutely true, I would say. With modernization and literacy rates going up day by day, people are becoming more and more conscious about their health. That means they are investing money into purchasing health plans, insurances. So, basically people's expenditure on healthcare has certainly increased due to need or choice. And as I said, that it's a never, there is no recession in this field, because people, as long as we are alive, we are going to need healthcare, or we are going to need medical help. So and again, going back to my point, the insurance, people are purchasing insurance, and that means there is increasing demand for medical professionals every year. When the demand for medical professionals increase, the demand for all the people who are doing the back end work, like medical billers, coders, or all the administrative people, all that increases. So what I'm trying to say, I would like to begin with saying that this is a field that's literally not going to have recession. And I'm not saying this, but this is like a very commonly known fact, kind of. So coming to the point here, medical coding, what is exactly medical coding? As I have, as you can see on my screen, it's a unique process of transformation of medical services, healthcare diagnosis and procedures into alphanumeric codes that are universal in nature. Okay, now this is a lot of word jargon here. So to make it simple, it's a process of assigning medical codes to diagnosis and procedures found in medical records. Okay, so to make it easy, a medical coder has access to patients' medical records, and they have to go through each and every chart, understand what is wrong with the patient, what are the orders that doctor ordered, what was the procedure, if at all it was performed, what kind of medicines were prescribed, what kind of medical consumables were used, how much effort did the physician put into coming to decision. So all these factors are taken into consideration by medical coder, and then they assign medical codes to their that particular chart, both ICD and CPT codes. Okay, then coming to so this is medical coding in a nutshell. Now, I have also said in my definition that these codes are universal and alphanumeric in nature. Alphanumeric because many times these codes are a combination of alphabet and numbers. Many times it's just numbers. So it doesn't have to be all alphanumeric all the time, but most of the times they are alphanumeric and they are universal in nature. That means the code for, let's say, tonsillitis will be the same anywhere that we go in the world. That's why we call it universal in nature. Okay, so that is medical coding. Let's go to our next slide. Oh, yeah, so I just have this like diagrammatic presentation. So medical services, healthcare diagnosis, procedures, they are translated into alphanumeric universal codes, and that's the process of medical coding. Now, I said that the coders have access to charts or medical records. Now, what do we mean by medical records? There could be so many things. So what counts as medical records is actually doctor's notes. That means all the notes that doctor writes about the patient. every time they visit, the patient's visit. The nurses notes, many times nurses are also involved in patient care. So whatever notes, and everybody or anybody who interacts with patient has to write notes. You cannot leave it verbal. Let me go back a few steps here. Whatever I'm talking about right now is regarding US healthcare. So this is, you have to imagine not a practice in India, like a small doctor's office here or dispensary that we normally go to. ऐसे तो नहीं है. This is a different kind of scene or a picture that one needs to imagine here. So this is typically run very professionally. So nurse होते ही होते हैं, doctors होते ही होते हैं. So you know, nurse कुछ लिखेगी, doctor कुछ लिखेगा. So that's why I'm saying doctors notes, nurses notes. They are all medical records. And sometimes if X-ray is taken, radiology report, then lab reports, transcripts from doctors. Many times क्या होता है? Doctors are not able to complete records by themselves, or there is a standardized format that the doctors have to follow. If that's the case, please mute yourself, guys. Okay, so that standardized format is not kind of followed. I mean, it's not possible for a doctor to do it themselves. So they hire medical transcriptionists. Medical transcriptionists actually hear the recording. So before that, actually doctors prescribe, I mean transcribe, or rather they record all their orders. So and so patient came, we did this, we did that, this medicine was prescribed, this was the BP, this was the, you know, all those things. So they sometimes record these notes, and medical transcriptionist actually has to listen to all those recordings and enter all that information into standardized form. That's called transcription. So these transcripts are also considered as medical records. Okay. So now the question that may come to anyone's mind is, why do we even require this step? Why bother with medical coding? Why can't we just say that, hey, my patient Paul Liberstein, let's say, had a stroke. We hooked him up with an IV. We gave this medicine into IV. You know, right on a blank piece of paper, not piece of paper, like, you know, in a chart. Just send that entire file to the insurance company. Why not do that? We'll try to find an answer, or I'll try to explain why we can't, why they can't work that way. First and foremost, I feel is, you know, sending that entire file to insurance company. That means we have no record left, or making Xerox and just letting people handle it is, like, you know, very risky, because all that information is very, very confidential. So just a couple of reasons that are coming to my mind why we can't do it. So, so medical coding happens every time in the Western world a patient is seen by a doctor. Okay, every visit a medical record is created. The healthcare provider, that means the doctor, reviews the complaints, patient's medical history. They make an expert assessment of what is wrong with the patient, and then how to treat the patient. And they document everything. Everything has to be documented. Okay. That documentation is the only patient's ongoing record. Okay. That is how the providers get paid. It is so important to have accurate documentation by the doctor, because unless and until the documentation is accurate or like waterproof, you know, tight, we as coders cannot assign codes which are accurate, specific. And unless we assign codes that are accurate, specific, correct, all those words, then the doctors will not get paid in an accurate and fast manner. So that is why it is really, really, really important for any case to be well documented. So I remember when I was learning about medical coding, my instructor used to emphasize that if it is not documented, it did not happen. That means if you don't see it in the writing, black and white, you are not to assume anything, and you are not to assign codes based on your knowledge. If it is documented, if you can show the documentation for the condition, that's the only allowed way to assign medical code. So that's basically how important medical documentation is for a medical coder. And by medical coder, I mean literally entire, even the doctor, because they will not get paid unless it is documented correctly. So as I said, well-documented case will lead to accurate and more specific codes that are assigned by the medical coder that will lead to fast and accurate payment of any insurance claim. So that is number one reason to assign medical codes, to get paid, I would say. Accurate and complete documentation that will lead to accurate and complete and fast payment of claims. So that is reason number one. Another reason to assign medical codes is when we assign medical codes, we are giving information to the payer meaning insurance company. So we are giving information to insurance company. We are giving following information to insurance company. What is patient's diagnosis? For example, it could be tonsillitis, diabetes, fracture, anything. Then number two, medical necessity. The service provided, the service that was provided, was it reasonable and necessary? We'll talk a little bit about medical necessity, I guess, a little later. So, but in a nutshell, what is medical necessity is the insurance company is constantly trying to figure out whether the service that was provided or all the actions taken by the doctor to treat that patient, were they reasonable, necessary, customary? Is it normally done? Is that really needed? Because they are the ones who are paying for all the services that are provided. So actually, I would like to pause myself here and just give you a little bit more brief idea. So the way it works in a typical setting where insurance is called as a payer and the doctor is called as provider, a patient walks into the doctor's clinic and they carry their insurance card. As long as you have purchased the insurance, healthcare insurance, you will be assigned with a card. The insurance number will be there, and the doctor's office, the receptionist at doctor's office will enter that information into their system, and they might have to pay a small token amount called as copay, and then they will be checked by the doctor, and then they go home. They don't pay for the entire service. Now it becomes the doctor's headache or the doctor's office's headache to get paid directly from the insurance company, because the patient is going to say, hey, I purchased an insurance plan. I don't owe you anything. Just talk to my insurance company. They will pay for my services. So it becomes a doctor's headache to prepare a proper claim, send it to the insurance company. Okay. And when they do that in accurate manner, that is when they get paid. And so by their headache, I mean it is the headache of the people who are running the office manager, the medical biller, coder, all those people. So we as coders will assign that code. The claim is prepared by either a biller or coder, and then that is sent to the insurance company. Okay, so that is my background. And now coming back to this. So medical necessity, that means the insurance company is going to always want to know that the service provided was reasonable and necessary. Then number three that you are communicating is treatments and services and supplies. What kind of treatment was provided? What services were given? Or were there any supplies that were used? Then any unusual circumstances or medical conditions, like was the patient in the wheelchair? Did the patient come walking? Did the patient have any special instructions to go along? Something like that. Any disease? Did the patient have any disease? So when this payer receives this information in complete and accurate code form, it absolutely is no reason to deny the insurance claim, and they get paid in fast and accurate manner. So this is the second kind of tying up reason that I'm trying to say. It's the same thing, like getting paid, and you are also giving them all this information, and you are getting paid for the doctor. So that is number one of why medical coding. I have this slide because medical coder is like a bridge between the doctor and the insurance company or payer. That means provider and doctor. Okay, provider and payer, sorry. So they're like a nice bridge. We are the ones who communicate for on behalf of doctor and make sure that the payer is paying the fair share or fair amount to the doctor. Okay. Then number two, medical coding. The reason for medical coding. Medical coding categorizes variety of information and brings a standard language for better communication between hospitals, physicians, and payers. So to talk a little bit about this point, there are a lot of thousands of conditions, like thousands of diagnoses, diseases, injuries, causes of death. There are also thousands of like services that a provider has to provide the doctor. There are numerous drugs, injectable, oral drugs, numerous supplies that the doctors have to use. What medical coding does is it classifies or categorizes these for easier reporting and tracking. Okay. Besides that, there are also a lot of acronyms, synonyms. It's like a lot of word jargon. I don't know. Like bio students will understand that medical knowledge or any knowledge is a lot of word jargon. A lot of words are involved, and one needs to understand those. So by assigning medical codes, we are helping them to categorize or classify these things. And when you do that, when you assign a code, like alphanumeric code or a numeric code, what it does is it becomes standard. You know, I'm saying tonsillitis, somebody else is saying quinsy, some other person is saying infection of tonsils. So it all means the same, but they are all using different words. So how am I supposed to create a language that is understood by all these entities? And that is done through medical coding. So what I can say for point number two is medical codes bring standardization, create a common language. By creating a common language that is understood by hospitals, insurance companies, doctors, nurses, health plans, HMOs, everybody. And you can go anywhere in the world, the language stays common. So that's why I'm saying it brings standardization and a common language. So that is number two reason for assigning medical codes. Okay. Then number three, medical coding helps and supports public health by utilizing data gathered to identify resource use, build actuarial tables, and manage risk. Now, to elaborate this point, now medical coding derives from public bills of mortality posted in London in the 18th century. So that is when it kind of started in the 18th century, which is literally almost 200 years ago. It was through correlating these that doctors determined the cause of cholera epidemic in London. Okay. So what they must have done is they must have gathered data, found some commonalities, and given codes to those commonalities, and used those commonality, the data gathered through those codes, and I'm sure that data helped them find reasons and medication or whatever, like other things that they needed to cure cholera epidemic. Now we have seen it is more vital now that as the data gathered through medical coding is used in improving healthcare in general. The data derived from codes are used to determine utilization, manage risk, identify resource use, build actuarial tables, and support public health in action. So we have seen this. I mean, the most recent example of this is the research and development of coronavirus vaccine. It was due to or as a direct result of data gathered and derived in the code forms. Because in order to, effectively test a vaccine or even create a vaccine, you need a lot of data because, how are you going to know whether it works or not? So data is definitely used and that data is usually transferred in, stored and transferred and utilized in the medical code form. So looking at a larger picture, the codes are helping in the public health sector. Then, so I think we have now established that medical coding, why medical coding, like it is absolutely necessary to assign medical codes. Let's talk about types of codes that are used in the USA. In United States, there are 6 official HIPAA mandated code sets serving different needs. Sorry. HIPAA is basically Health Insurance Portability and Accountability Act of 1996. This is an act or a law that protects the health information, okay, in the United States. There are the 6 languages that we, the 6 code sets are first ICD-10-CM, International Classification of Diseases, 10th revision. This is CM is clinical modification. This is used to code diagnosis. Then CPT is current procedural terminology. This one is used to code the procedures for physicians' offices. Then HCPCS level 2. Sorry. Healthcare Common Procedure Coding System level 2. Then ICD-10 PCS, 10th revision again. So this one is used for procedural coding, but in the inpatient setting for hospitals. CDT is codes on dental procedures and nomenclature. That means it is the dental codes. And NDC is National Drug Codes. HCPCS level 2, I forgot to mention, these are used to code the coding for medical consumables and medicines. Okay. So these are the commonly used code sets, the 6 code sets. Then coming to the favorite topic, I think, or the reason why you guys are probably here, starting a career in medical coding. How does one start a career in medical coding? So it's not that hard to start a career in medical coding. The easy steps, the 4 steps that I usually ask to follow are: learn about medical coding, become certified, start working in the field, and you can take it from there. Other 3 steps. The last one is you can be a life science graduate or non-life science graduate. So what you need to become successful or even start a career in medical coding field is knowledge of anatomy, a base knowledge of anatomy and physiology or medical terminology. And that is the reason why I say that it's a field very good for people from life science background. That means pharmacy students, then BSc microbiology or any biology field, BSc, then nurses, doctors, obviously. So these are the people who can definitely enter this field. And if you are someone who's not from medical life science background, but you're interested in this field, you can certainly go about it. You will need to learn about medical coding, medical terminology and anatomy for sure. For that, you will need to basically, if you're a self-motivated learner, you read and you learn about it, or you can take a few classes which are offered. Then what else can I say about it? I have trained, as I said, I have trained a lot of candidates. I have trained many candidates are from life science background, but some who are not, I have also trained them. They can do it. It's not a big deal. Okay. Then we keep talking about medical coding, and as I said, it is happening in the US. And then I'm delivering this webinar for, I believe, Indian audience. And yeah, I have a question here, medical terminology. So there is a book that I like to refer. It's Language of Medicine by Davy Allen. I'll just write down that name. Language of Medicine. You can find this on Z Library. It's a free resource. Just Google it. You will find something or other. If not there, I'm sure there are other places you can either purchase or free download. Yeah, so coming back to my point, why are we talking about this in India? So the answer is outsourcing, as I said. The healthcare services outsourcing industry, that's like evergreen, and India is their favorite destination. Mostly like 80% of their work comes to India, and even the medical billing coding work. There is an increasing demand for medical professionals across the globe, which means there is a good job stability and security in this field. India is emerging as a hub for healthcare outsourcing, where coding is the most preferred option by professionals. So what it does is basically the work that from most of the companies, they have a setup in the US, and they also get their, basically there's the operations part is outsourced to India, and that is how they are getting their work done. They're training people here to become medical coders, billers, the AR callers, then what else do they do? The denial management people, everything. Okay. And when they do that, you are basically creating a workforce here. The work is outsourced here in India, and what we get here is job security, and there is absolutely no, there is no recession in this field. So with exposure to both IT and healthcare, the coders, they find a new avenue to polish their careers. Professionals are able to work in a secure work environment, and there are a lot of growth opportunities. So that's what I'm, that's what I had. That's why I had this diagram of outsourcing. Who can start? I have already spoken about that. So life science graduates, pharmacy graduates, doctors, nurses, physiotherapists, even non-life science graduates. Then, yeah. So once you start the career, rather I would like to go this way. The question that I'm asked often is, what are the job opportunities available in the market after doing medical coding, and how is the career growth in this field? So one typically starts their work as a junior medical coder, and then they work up the ladder as senior coder, team leader, manager, so on and so forth. Now there are some companies who may hire non-certified coders. Okay, and what they do is then they train the candidate in their specific process, and from there. So this used to happen in the old days when medical coding was literally very, very new, like about 7-8 years ago. Now this field is pretty popular. So the companies are looking for certified coders. So that's why when you become certified, you are increasing your chances of getting hired. And it is also observed that the certified coders do make more salary compared to the almost 20% more salary compared to non-certified coders. In order to increase your chances, or in order to kind of better your chances of succeeding in this career, you will have to make yourself familiar with various specialty codings like radiology coding, E&M, anesthesia, HCC coding, then emergency department coding. So having knowledge and experience in these different specialties, it definitely helps in your career growth. Then if you are somebody from if you are somebody who's a medical professional, like a doctor and a medical coder, you can use these skills to become valuable in other healthcare business roles like office management, auditing, clinical documentation improvement. Remember that slide, like where I was emphasizing about the correct documentation, watertight documentation. It has literally become a new field, clinical documentation improvement. And they are looking for doctors or pharmacists, and they want you to have knowledge of how to make the documentations accurate so that there are no mistakes. Because if there are mistakes, then there are denials. When there are denials, the patient, the doctor ends up losing money. They also have to spend more money in order to follow up and get paid. So the denials are very costly for providers. So they try to avoid denials by any means possible. So they try to go to the route where the documentation is created by the physician. So they want the coders or these experts to then train the doctors, if at all they can, in order to create documents which will actually lead to correct coding and less, like fewer and fewer mistakes. So you can enter that field. Then you can also work as a business analyst. So medical coding essentially opens up a lot of avenues in healthcare businesses. Okay. Then few more things that I can say about medical coding is it's the most coveted career field according to US Bureau of Labor Statistics. The job growth in medical coding is double than the other industries. Growth is expected to be 22% by 2026. Okay. Then salary range in India is 15 to 40,000 per month. Certification positively affects the earning potential. Then I have kind of mentioned these things. Okay. Then what else? What are the opportunities in the medical coding field? You can work as medical record coordinator or medical coding specialist, billing specialist, technician. I actually gave some more examples here, like the manager, then analyst, or a clinical documentation specialist. I would like to actually add a few more points here. Now, which industry will hire medical coding professionals in India? It's the healthcare industry, of course. Medical coding professionals are typically hired in the healthcare sector. Currently, it's most popular in the US healthcare. That means the company. So in India, you will not be hired by the doctor directly, but it's the companies that are outsourcing work, the billing coding companies. As I said, they have their operations, they are being outsourced in India. So these are the companies, the RCM companies. They will hire coders. Besides that, like bigger hospitals can also hire medical coders. And another question that I'm being asked is like, can we think about entrepreneurial opportunities in this field? So my answer to that is yes, definitely. I mean, if you are someone who is motivated and willing, and you have the drive to succeed, then you can certainly set up an operation here. So the companies that I'm talking about, you can be the person who can set up a company here in India, hire people, train people, and start work. Okay. Then another entrepreneurial opportunity is to start training institutes or training centers for students. What it does is, you are creating a workforce by training the local population, and you can reach the people in the suburban or rural area also by doing this. So you're opening opening new doors for their careers as well. Now, say you have decided to take a course in medical coding. If you want to do that, the things that are typically covered are introduction to human anatomy, with explanation of different anatomical terms and body systems, introduction to business of medicine, understand and apply official guidelines of ICD-10, CPT, HCPCS level 2. Okay, understand the way to determine the levels in the E&M service. That means the E&M coding. Code a variety of cases. You need hands-on experience to use those code books. Okay, so code a lot of cases using CPT, ICD, and HCPCS level 2. Apply coding conventions and strategies when assigning diagnosis and procedure codes. Identify the information in parentheses. Be able to understand and apply all the references and cross-references in the index and tabular list. Be able to understand and apply references, cross-references in index and tabular list of ICD-10 book. Provide mock tests to give the feel of real certification exam. I think what I have missed in my presentation so far is the CPC exam. I would like to talk about CPC exam. I have a slide here. There we go. So CPC exam, becoming certified, meaning you have to pass this CPC exam. CPC, Certified Professional Coder. CPC, it's an exam, 4 hours exam. There are 100 multiple choice questions. There are questions from anatomy, medical terminology, actual ICD, CPT, HCPCS level 2 coding questions. So there are case scenarios given. You have to use your code books. It's an open book test. So you are allowed to take your books. It's an open book test, so you're allowed to take your books, or rather you have to use your books and find the codes. And passing is 70%. That means you have to get, please excuse these figures. I'm sorry, these figures are wrong because this is old. I mean, they are wrong, meaning they were correct till last year, but now they have changed the exam. It used to be 150 questions and 5 or 40 minutes, but now it is 100 questions and 4 hours. Okay, so you have to get 70 correct answers out of 100 in order to pass. And then you are awarded certification by AAPC, American Academy of Professional Coders. And the certification is internationally accepted in USA, Canada, UAE, India, everywhere actually. Other certifications like CIC, COC, CRC, they are also offered by AAPC. Okay. Okay, what else? Yeah, I was on this slide. Now, when you're looking into choosing any program like billing and medical coding billing program, you have to take into consideration your schedule, whether you want to commute to classes or you want online sessions. You want a flexible options where there are recordings available. Then does the program offer personalized attention? Will your questions be answered if you have any doubts? Will the program help you develop skills and knowledge? You will need to start working as a medical billing and coding specialist. Does the program include hands-on practice with medical coding systems or manuals? Because I feel it is important, rather that's literally the way to teach students, because I give a lot of hands-on training. I believe in letting the students use their books. Otherwise, they are not going to know how to code. And that's why you are here. You are here to learn coding. So it's very, very essential that they are given hands-on training. Then, sorry, will the coursework cover topics that are commonly included in the industry certification exams? Does the school offer resume writing assistance and or interview preparation? So, if there are any places which help in, sprucing up your resume, if they offer mock interviews, those are add-ons. By all means, take advantage of those. Is there job search of help available? Like I am asked, like this is the one question I'm asked 100% of the time. Do you provide job assistance or no? Do you provide any placement? That's like a favorite question that is being asked, because these days everybody's looking. You're investing money, you're putting money into any course, you're looking at returns. So you do want to be placed in a good industry, or in a good company. So yeah, some people have direct tie-ups and some people provide references. So it can work either way. And if there are any financial options available. So I don't know whether it really applies in India, but I know that there are some people who are trying to get some financial aid for students who cannot really afford. What are different other qualities that can help you become a good medical coder? Decision-making skills, which will help you analyze and diagnose the medical records to determine the best way to code them. Attention to detail, which is required to accurately record patient data. Good communication skills, interpersonal abilities, even in the high-stress situation like billing discrepancies or rejected insurance claims. Rejections do happen, so you can't let that affect you really adversely. You have to go to the root, do the root cause analysis, find out the reason, and make sure that you are not repeating that mistake. Then computer skills, basic computer skills are required everywhere these days, like word processing, spreadsheet and database software, including EHR. There are a lot of electronic health record systems like the eClinical Works. Then what else? I can think of a lot of them. Then ECWS. So yeah, there are a lot of different systems, EHR systems, and if you are familiar with those, that's an advantage. Okay, so actually I am pretty much done with my presentation. I let me I'll keep this slide on. You guys can think and post your questions in the chat box. I will also go through my notes and see if there is anything I have missed while you are writing questions, because I'm combining a few notes from different presentations. And yeah, so if there is anything I would like to add, I'll use these 15 minutes to do that. If you have any questions, please post them in the chat box so that I can answer them. And if some others may also have that question or doubt, and it will get clarified. Age limit to write the exam? No, there is no age limit. However, that's a good question actually. There is no age limit to write the exam and become certified, but you may want to check with the HRs of different companies. Like some companies don't want their candidates to be very then they might have some age criteria, and unfortunately they cannot openly say that, because that's kind of discrimination. So no, I mean, technically there is no age limit. There certainly is no age limit for the certifying exam. That much I can say with guarantee. Anything else? Are you all from some same college, or how did you hear about this seminar or webinar? If I can find out. I mean, is there a common denominator, or is it just people from different places? Oh, you are all from Philippines, and here I was. Oh, Philippines from college, India. Oh, okay. Not everybody is from Philippines. Yes. I remember my last webinar. It was entirely for Philippines audience. So yes, I mean, this pretty much applies to you guys also. Um, in, as I mean, along with India, Philippines or southwestern countries are like their favorite destination for outsourcing from the US by college. Okay, which college is it? Pharmacy college or something? So India, Philippines, these are two favorite destinations. So what they're looking for is people who can speak English and understand English. So obviously, India and Philippines become the two most favorite countries. MSc Applied Genetics. Wow, that's nice. Okay, so there are people, from what I understand with them from the messages, is totally diverse group of people here, which is great actually. I get to cover. I mean, I hope I have covered things that you were looking for. If there is anything else you would like me to discuss or talk about, I have some time. Additionally, I hope I have inspired some of you to join this field, join the course anywhere, and learn about this field. It's an interesting field. I mean, I absolutely like working in this field. Doctor of Pharmacy. Is that like PhD in pharmacy? B Pharm. Okay. Okay. Gene therapy regarding stem cells. Ooh, that's not my specialty at all. Gene therapy with stem cells with multiple mutations or non-technical. No, like the genetics, that's really not my specialty, so I'm not the right person to answer. Which is the top? Oh, some top companies, sure, like Ghate. They have presence in Mumbai. Then United Health Group, Optum. They are present in India. Oh, there is somebody from US. That's great. How did you hear about a webinar in India? So anyway, I'll keep continue talking about the companies like Ghate, United Health Group, or Optum. Then there are V Technologies. Then there are a lot of companies in the south. If you are someone from south, just Google, and there are too many companies. Then there is Augustus. There is 3Gen. There are, I'm just trying to think, there are like these niche companies, small, mid-size. I'm telling you, they are the best ones to work for in India, at least. In the US, of course, there is Optum. Then there are a lot of like work from home opportunities in the US. You have to be physically present in the US, and I believe you have to be certified. I think so. I mean, at least you have to have the knowledge. And as I said, if you are a certified coder, it definitely increases your chance of getting the job. Otherwise, why will they hire you? On what basis are they going to hire you? So I have like 8 more minutes. Might have their own selection criteria for medical. Yeah, I mean, but the basics remain same: being certified, having a at least degree, or if you're like B Farm, many companies are okay with the diploma in pharmacy also. Yes. Anything else? I cannot say that until you're certified, you won't. No, not necessary. If they have, I'll tell you, if the company has a process and they are in dire need of coders, they will hire you non-certified, because then they have a niche kind of project. They will train you into just that kind of work. They'll train you in doing that exact kind of work. So it is not like you just will not be hired, because I have some students who got hired even without certification. How much growth is, I speak about the growth, like, the growth is expected to be like 26% growth by 2026. No, not 26. Let me go back in the numbers. I don't want to give out wrong numbers, but I have included that information in my presentation. Where is it? 22% growth by 2026 in the medical coding field. Yeah, even fresher can join, sure. Why not? Okay, any other questions? I'll wait for 2-3 more minutes. Okay. Anyone else from outside India? Oh, what is the procedure to join? I am not sure. You will have to check with the Learn to Upgrade people. I am the one who trains usually in medical coding, but they arrange the course. So you will need to discuss with them, the people who organize the seminar, webinar. Anyone else from outside India? No. In the US. In the US. I think for the beginners, they are paying $20, around on an average $20 per hour for freshers, I'm saying. Yeah. I mean, somebody's asking me US companies. Yes, of course. You can work for in the US healthcare. You can work in the US. If you're living in the US and if you have the work permit, obviously you can work. In India, basic salary is about 20 to 25,000. I think again, I included that also. Where are my figures? Between 15 and 40,000 per month. That's the salary range, and it increases. Okay. I see that people don't have many more questions. So thank you so much for attending. Once again, I hope I have kindled interest in all of you to join this field. I hope I have clarified your doubts. I hope I hope to see you all joining this course and become successful in this career. Okay, so I wish you all very, very best. Time period to complete these courses. So in my opinion, you should give at least 3 to 4 months to study properly and then appear for CPC. Okay. All right, I'm going to stop sharing my screen. And thank you so much. And best wishes.